Hi, everyone. Welcome to the Harmony Foundation podcast series, and I'm pleased today to be joined with Frank Ocaña and Carly Dean with the Boulder County AIDS Project. Welcome.
Thank you.
It's good to have both of you here. Before we talk about the project, let's talk a little bit about your backgrounds and what got you into the field. So let's start with you, Frank. Can you tell us a little bit about your background and why did you get involved with the AIDS Project?
So when I went to the University of Colorado Boulder, I got involved with the student group that provided sexual health education, and BCAP was a community partner, and that connected me to HIV work.
Mm-hmm. Had you always wanted to be involved with HIV work, or is this something that just you fell into?
More so fell into,
yeah.
And then, like a lot of social justice issues, became a calling that I stayed close to for quite some time.
It's interesting because some people ask me about how did you get into the field of addiction, and I usually tell people I didn't, it picked me. Is that what you would say? Is that it kind of picked you?
Kind of.
Mm-hmm.
Yeah.
But you found yourself in a position where you really wanted to do this work.
Yeah, I mean, I think I was, I entered the field post highly active antiretroviral therapy. Mm-hmm. So it was like the mid-90s when we just started to see so much devastation. But then we also started to see so much hope in terms of people being able to access treatment that was actually starting to work. Mm-hmm. So really to try to just have a positive impact on how the epidemic.
Because it was so negative for so long. It was great to be able to move in a place where it's positive. How about you, Carly? How did you get into the field?
I have been interested in HIV activism and everything surrounding the issue since I was a kid. Mm-hmm. And after college, I went to the Peace Corps in Nicaragua and did a lot of sexual health education. I did a lot of work with HIV and high-risk populations in Nicaragua, which included transactional sex workers and mobile populations who worked at coffee farms. And when I came back to the States, I found Boulder County AIDS Project and started volunteering with them as a tester and as just a program volunteer. And this position opened up, and now I'm here.
That's great. Mm-hmm. So let's talk a little bit about the Boulder County AIDS Project. If someone were to access services there, what could they expect to see when they come in?
So the Boulder County AIDS Project, just to give a little bit of history, was founded in 1985. So, and it has been serving Boulder, Broomfield, Gilpin, and Clear Creek counties as the local HIV/AIDS service organization. So when folks walk into our doors, they can expect to be greeted in a warm environment. With people who have been connected to and a part of HIV work for quite some time, and who understand that people have such diverse needs, when accessing support and trying to get linked to medical care and treatment. Mm-hmm. So they can expect to be greeted by a person. Mm-hmm. And somebody will prioritize taking time to really understand what they're needing.
Mm-hmm. And what kind of services are they offering right now?
So right now, BCAP has two main services. We have HIV care services, which are specific for people living with HIV in Boulder, Broomfield, Gilpin, or Clear Creek counties. And that will include medical case management, housing insurance, emergency financial assistance. We have a food pantry and professional pro bono services.
Okay.
And then as part of our HIV prevention services, we provide, and all these services are free, but we provide HIV and hepatitis C counseling, testing, and referrals, educational presentations in middle schools, high schools, and other community facilities. Mm-hmm. We have a syringe access program, so folks can come in and get new needles and supplies that they need to inject safely, as well as education around safer injection practices, wound care information, and then also trainings on Narcan for to help avoid opioid overdose. And we also have a program called Atlas, which is a service learning peer-led program, which really provides a creative space for people to help decrease HIV transmission amongst men who have sex with men, which is one of the subpopulations that's most impacted by HIV in our area.
Well, it sounds like you've got great services that are full spectrum from prevention all the way on. And it sounds like it's a very different day today in treating people with HIV than it was years ago, which is so great to hear. So, Carly, this is your first visit to Harmony.
Yes.
And I know that you are currently living in the Westminster area. So how often do you get up to Estes Park?
I really just... not often enough. And it's really, if I have friends or family visiting from out of town, we come up, we do the Stanley Hotel tour, we do the Rocky Mountain National Park. I used to come here a lot when I was a kid. We'd come up here for 4th of July, but even now that I live here, I don't come up enough. It's beautiful up here, and it reminds me of home.
Right, and as far as Harmony as an organization, you hadn't really heard of it until you came up, or...
Correct, yeah, until we had our first communications with the staff members here. I had no idea this place existed.
So what do you think about it?
I think it's beautiful, and I'm willing to become a live-in health educator. But it's very tranquil and very peaceful, and just being here as a guest, I feel very at peace. And very rejuvenated, and I just feel like this is a very healing area.
Well, thank you for that. We're really excited about working with you all and building a partnership with you guys. So, Frank, when you think of the word Harmony, not necessarily our organization, but the word Harmony, what does that mean to you?
I think for me it's being in connection with oneself in an authentic way.
I like that. Yeah, it sure does, doesn't it? And we do try to work with people to help them find that. So that's nice to hear. Thank you. And if someone wanted to access services at the Boulder County AIDS Project, how could they get in touch with you?
So we're open Monday through Friday, 9 to 5:30. We have an office in Boulder and an office in Longmont. The best number to call is 303-444-6121. And folks can also access information on our website, bcap.org.
Wonderful. Well, thank you both for taking the time to visit us up here in Estes Park, and we look forward to working with you.
Thank you.
Thank you so much.